Says about to start. Okay, looks like we are live. Let me just close this. So hello, everybody. Welcome to our live discussion today. I was just chatting with my friends who are here with me, Natalie and Toby, and telling them that today's my 48th birthday. So happy birthday to me. I wanted to apologize for that last discussion. I was outside with the dogs pulling weeds and trying to put my yard in order, and I just totally neglected it, and I didn't hear any alerts or anything. I should have heard alerts when you all came in the room, so I apologize. And those of you that waited for a long amount of time, don't ever do that for me again. As soon as you log in, it recognizes your attendance, which didn't end up being necessary, and then never wait for me for more than 5 minutes, because that's just rude of me to keep you waiting at all. So there's your public service announcement. And so everybody just got full credit for that discussion. So you got to skip it if you were skipping it. And if you sat there again, I owe you lunch sometime. Come see me in my office and I'll take you over to Eastway. It's my favorite spot on campus. So tonight the topic is prevention. And I'm not sure, this is probably dangerous for me to try here. I'm going to pull it up on my phone. What we know about prevention in general is that, they say an ounce of prevention is worth a pound of cure, and that can totally be true. Logging into Canvas. And so, most of usually it's estimated somewhere between 85 and 90% of our healthcare costs in the United States, at least, are preventable. And we know really what works for prevention. Think about COVID, if we want to still talk about COVID, or not. But think about pretty much everything. Most of our leading causes of death are entirely preventable. And we know exactly how to reduce a considerable amount of that morbidity and mortality. Why won't it show up? Here we go. All right. So yeah, over 85% of healthcare costs and 75% of deaths in the US are consequences of preventable health issues. Now, we're never going to prevent everyone from dying, right? But it's early death. And also, if we count in their years lost to disability, that gets even worse. So lifestyle choices and health behaviors are the most important health concern in this regard. So the questions were, why do you think it's so difficult to get folks to take preventative care? I'm a good example. I'm not a fan of sunscreen. It makes my partner very upset with me. Seatbelts, helmets, condoms, eating healthfully, sleeping well, right? Being physically active, managing our stress, so on and so forth. So what are things that we do really well with regard to prevention? What are things we still need to work on? And how does our healthcare system contribute to the issue? So those were the question posts. So my friends in the room, you're free to chime in if you want or not. Let me slow down and ask a more pointed question. So why is it so difficult? What are the reasons why people, ourselves included, don't necessarily want to participate in prevention efforts, even when we know that they will work?
I think sometimes it's the fear of what comes with knowing that you're going to get something. Like, for example, I'll use cancer. Like, if the preventative things that you have to do, like get tested and know that, oh, let me prevent this before I get it.
Mm-hmm.
That fear of, I might actually have it, and then it becomes a budding, is something that prevents people, I think, in general from.
Yeah, especially with what you're talking about, Toby, right? Thank you so much. Those preventative screenings. One of my mother-in-laws refuses to get a colonoscopy, because she thinks it's too problematic to do the prep, which that would be another issue with prevention, right? I don't really want to do the thing. Right. But B, that she's, she just doesn't want to participate in it, I think, frankly, because she's scared. She's like, they always find something. And I'm like, well, finding something in a colonoscopy is a good thing,
Right.
Yeah. Other thoughts? Welcome, Quentin. Feel free to join us as a talker or hang out. No worries either way.
Hey, how you doing?
Good, thanks. So we're talking about why it's difficult to get people, ourselves included, to participate in prevention efforts. So I was working with the Upward Bound students this morning, and I said, how many of you slept the appropriate hours of sleep last night? And they're just looking around, and I said, what is the appropriate number of hours of sleep for you all? And I had like 6, 8. I'm like, it's 10. Let's try raising our hands again. And none, most Americans are not getting enough sleep. Some of us even brag about it. Martha Stewart, Donald Trump, they tend to be people that say, I only sleep 4 hours a night. And it's like, well, so what are some
10 hours was the appropriate? I thought it was like 7.
for teenagers? These were Upward Bound kids. So they were like 15, 16.
Oh, okay.
Yeah, but even your age group is probably 8 to 9. 10 would probably do you good. But my students in person, they roll their eyes at me. They're like, I don't have time to sleep 10 hours, right? But sleep hygiene is something I take very seriously because I don't want to know myself when I haven't gotten enough sleep. So I walk my dogs at 4. So I try to be in bed by 8, 9 o'clock at the latest, which is no fun, right? Which brings us kind of back to what I added to Toby's, is that oftentimes the prevention doesn't seem fun. I said to my spouse, I put on sunscreen because I did, but it was 30 and I only put it on once and I didn't reapply it, because reapplying it would have meant get out of the pool, dry off, reapply, wait for it to dry and get back in the pool. And I was playing with my nieces and nephews at my birthday party. So I didn't choose to do that, right? So that's kind of like the sexual equivalent of interrupting the heat of the moment, which is why people don't want to use condoms, right? Contraceptives often have side effects, all those hormones, or, the discomfort with having to talk to our partner about it. I always think the fitness and nutrition is kind of easy. I love food. So controlling my portions and making sure I'm eating a healthy balance isn't always my favorite thing to do, right? Physical activity takes effort. We have to go find it. We have to find something that we enjoy to do. So that's definitely a major, there's lots of reasons. Do you think that, I said something that I think maybe is an opinion, though it is backed in science, but do you think that most people believe that the prevention efforts will actually work? So do people believe that like wearing sunscreen prevents cancer and that, not smoking reduces our risk of heart disease?
Probably to a certain extent, but I think a lot of people think that, it won't happen to me type deal.
Or like it's worth it, right?
Yeah.
I had a grad student say, you eat bacon? Do you know every strip of bacon you eat takes 1 minute off your life? And I was like, I think it's a fair trade. Actually, the first thing I said was, but have you ever had it dipped in chocolate?
Have you ever been to First Watch?
No, I don't think so. Do they dip it in chocolate?
No, it's a breakfast spot, and they have this thing called $1 Million Bacon, and it's like caramelized. It's like really crispy.
Oh, like maple bacon.
Yeah.
Yeah, and I'm sorry, and I don't eat it every day. And when I eat it, I maybe eat a piece or two. Take the minutes off my life, which you could call me on it at my deathbed if I'm like, I shouldn't have eaten bacon. But we do the same thing with cigarettes, right? Isn't every cigarette, what is it? 2.5 minutes off your life or something? But it's like, does 2.5 minutes feel like a big sacrifice for that cigarette when we really want it? Like, no, right? So the exchange isn't always there either. So other reasons? Go ahead, Natalie. I'm sorry.
I think a lot of people don't believe the statistics either. They just think, oh, where are you getting this stuff from? This is made up.
Okay.
So I think that plays into it as well.
Like the stuff I just said about taking a minute off your life, right? It's like, yeah, who did that math, Lori?
Like how did they calculate that?
They did it by years of life lost. And then you're right. How did they get it down to strip of bacon though? I will look that up and put it in there, because I shouldn't say stuff like that, especially not during class if I can't back it up. So I'm going to look it up. A student said it to me, but I'm using it as a reference. So, but I'll definitely look that up because the internet is amazing, right? What about our healthcare system? I mean, this is difficult. I've taught this class for so long. So pre-President Obama and the Affordable Care Act, this was a slightly different conversation, but I think our healthcare system in America is still a little bit problematic. But how does our medical care, our health care in the United States further maybe complicate the issues around prevention?
Because a lot of people will feel like they get medications and then it have some type of side effect that lead to you taking more medications.
Sure.
They find something, then it just keeps, it's like a snowball effect. Everything's, yeah.
Right. And actually, Quentin, I'm going to say, though, that those medications are generally like a treatment, right? So like a secondary or tertiary prevention, not a primary prevention, right?
Yeah.
So like I've often complained, and this is very different after the Affordable Care Act, where now a lot more people have access, right? And people have access without the co-pays for preventative visits generally. And there are some little I can't think of it, like loopholes in that, where like smaller businesses don't necessarily have to provide that, so on and so forth. But like when we were hoping for people to get their initial COVID vaccine, right? We're like, everyone, it's free. And people are like, well, why isn't insulin free? Because that's problematic as well, right? But my insurance, which is really good, and so I'm not complaining about it, but if I fall over from too much chocolate covered bacon with a heart attack and need a coronary bypass, it pays for that. But if I want to go to a dietitian to get help with my diet and join a gym to work out, it doesn't cover that, right? Yeah. So it's like, is prevention really built into our healthcare system or not? Like, my medical insurance doesn't change. I mean, there are consequences, right? Like those of us who are nicotine users, sometimes our health insurance and our life insurance policies will be a little bit more expensive. But my health insurance won't help me go get counseling unless I say I'm struggling. It won't help me. Like I said, it won't help me fix my heart unless I have a problem. They're not going to pay for my dietitian, which I can see for free at Kent State because we all can, just as a side note. Or my gym membership, right? I would have to pay hundreds of dollars to join even the Kent State gym. So I feel like that's part of the problem. Go ahead, Natalie.
Oh, I think a lot of healthcare or plans are actually changing now and going towards the prevention and like giving you like credits or helping you with your deductible if you do get like your blood work done, or if you go get your A1C checked, or if you sign up for like a gym membership, like they'll help you with some of the costs. So I think I see the change.
Thanks, Obama, right? And I'm saying that being snarky. For those of us who are unaware, people say thanks, Obama, like in a snarky way, but I'm saying thanks, Obama. Right?
So I think I'm starting to see the change or the shift in wanting to do more preventative measures.
Well, and even from a fiscal standpoint, right? My apologies, Quentin, but from a fiscal standpoint, we know, that article, an ounce of prevention is worth a pound of cure. That's fair. When we first started doing regular mammograms, when people wear bicycle helmets, like there's real direct cost benefit to prevention as well. So it's smart for our employers and our insurance policies to want us to incentivize us. And as an employee at Kent State, I can make, I think, $350 each year by filling out my health risk assessment, letting them test, or bringing in my evidence from my doctor that my blood sugar was tested and my cholesterol was tested. And if I participate in like yoga classes or things, I earn points towards that bonus money. So my employer is doing a good job, I think. Quentin, I apologize. I interrupted you.
No, I was just going to, like my mom, she gets money back. I know she talks about that all the time. I got to get my days in at the month or my days in at the gym this month. So she gets her money back or something like that.
That's awesome. Yeah. I need to read my policy better. No, I know we don't have that here, but that doesn't mean it's not elsewhere, right? One of the cool things about the internet boom was companies like Google and, and they have their problems too. I don't mean to say that, but it kind of changed workplace climate in a way that I think post-COVID, if and when we ever get there, is going to have to happen again to bring people back to work, right? So like Google, when they first opened, had on-site daycare for children, had on-site medical care, had like cafes that were selling or even, providing food for the employees from like 150-mile radius, trying to keep a carbon footprint down, and, with spaces where people could go meditate or like have a milkshake or whatever would keep them happier at work. Also to help, when those clinics are there and you're trying to get everyone to get their flu shot, it's like, well, I got to drop my kids off at daycare and when that excuse becomes like, well, the daycare's right there and the immunization clinic's over there and we're paying for everything,
Yeah.
I think one of the most powerful examples, which is not really related to health coaching, but the school lunch programs, school nutrition, I should say, programs are that way too. Because once a school has a certain level of poverty, which is actually pretty low, like 40%, the whole school can qualify for free nutrition programs, so breakfast and lunch. And then that breakfast and lunch that those students then get shows their, all of their academic achievements, then their attention, all of that improves as well. So there's a ton of really powerful evidence that prevention works. So really it is that we're trying to get folks to buy in, right? To believe us when we say, hey, it works. We have to, when you think back to the health belief model, we have to try to help people reduce the barriers and increase the benefits to whatever the preventative action is. Right. So I will sometimes spend the money and buy the sunscreen that's still low because I do want to get some color, but that is going to stay on longer. Right. Versus the cheap stuff that I'm buying. Right. Or if we have other incentives, different things that inspire us to participate in those prevention things, that increases the benefits. Right. Because we don't always we say like, work out, you'll feel better. It's like a person maybe has to work out a bit before they actually feel better. So if that reward is delayed, it doesn't always feel worth it, So when we're working with clients as health coaches, how do you think we help them? Because generally they're coming to us, right? I mean, in very rare occasions, sometimes some of my colleagues, they do the like alcohol and drug education programs for somebody like on campus. If they get caught with an illicit substance, they have to like go to classes to learn. So those folks aren't generally coming there of their own volition. But generally as health coaches, people are coming to us with, I really need to work on my fitness or my diet or my whatever it is, right? And they'll say, I need help. And so how do you see, based on what we've been learning or what you might have already known about how a health coach can help a person work with prevention? So keeping in mind that we're always client-centered, right? And so we want to make sure that no matter how we're talking, it's more about asking questions than telling or prescribing. So we would say perhaps things like, what is your goal? You said you wanted to get in better shape. Tell me what you mean by that, because some of us want to build muscle. Some of us want to earn flexibility, right? Some of us want to be stronger or faster or to jump higher, right? One of the coolest things about when we were in Africa, we were working with the Sports Leaders Institute of Zimbabwe, and we were working with the athletes, and they were elite athletes, but they didn't have the same pedagogical knowledge that we have here in the United States. So with the coaches, for example, and I was the health educator, Dr. Kane Bish came along as the registered dietitian, and Dr. Glickman came along as the exercise physiologist and exercise scientist. And so we were talking about differentiated workouts for differentiated athletes, right? Basketball players and football players don't do the same workouts. The person who wants to run the 50-meter dash does a different workout than the person that, needs to run 100 yards with a football in their arm, or, jump high to dunk a basketball or whatever it was. And to them, that was like, oh yeah. And then Dr. Kane Bish also started talking to them about differentiated diets, which was helpful too, right? So with clients, we would say, what are your goals? And then if they said, well, I want to increase my flexibility or my stamina or whatever it is, then we would, again, not necessarily prescribe a workout, but maybe help them more with the what's the word I'm looking for? Like, well, how can you find time in your day to do this, right? What's the schedule like? What are the things that have been preventing you, or the barriers, right? What are the things that have been getting in the way of your ability to exercise? Think about like Mommy and Me exercise classes, right? Those happen because parents were saying, I really need to work out, but I have this newborn and I don't want to leave them, or I can't find care or whatever. And so they said, wow, you could actually use your baby as resistance training, right? And so then folks started doing their workouts with their babies to help overcome that barrier, right? Plus you're bonding, so on and so forth. So one of the biggest things too is just thinking about goals, right? It's the reason I love the theory of reasoned action plan behavior, frankly, is because we have to have intention to act in certain ways, right? Not always. You can accidentally do things you didn't intend to do, right? A lot of apologies start with, I'm so sorry, I didn't mean to, whatever it was. I didn't mean to miss our last live discussion, for example, but I did. And so how did I set myself up for better success tonight, right? So I didn't do it again. I adjusted my calendar, which was part of the problem. I told my spouse, right? I made sure all my alarms were on. I paid better attention to the clock. And so, I had a better intention. And so when we think about a person who says, I really want to do this prevention thing, thinking reasoned action plan behavior, we have to understand what their attitudes are about the different things, right? If I think, if I'm being honest, one of the reasons I don't wear sunscreen is because I feel like I have Hungarian skin. It's olive to begin with. It takes color well. And I go to the dermatologist every year and get skin checked. And she hasn't said anything, so that doesn't mean that I might not have a problem. It doesn't mean that I don't recognize the risk, but it does add to the pile of why I don't generally concern myself with sunscreen, right? Even as I'm starting to age and starting to see the real effects of the damage to my skin, I have never been anybody that really put that much into, what I mean? It doesn't bother me that much, but maybe as I get older, I don't know. 48 is not that old. So maybe in 10 years, I'll regret my choices. I don't know. And then he'll say, I was right. And he will have been right. But in any case, that's part of it too, right? I just walked right into one backwards, which is we can do the preventative things sometimes and they don't prevent anything, or they don't prevent it all, right? I mean, no method of contraceptives, for example, or birth control is 100%, not even abstinence. And so sometimes people do the behavior to prevent the thing. We can't prevent all cancer, for example, right? Like I said, we can't prevent all death. We all are going to die, most likely, unless something changes in our lifetime. All of us are going to die. But what we're trying to do is postpone that, right? And increase the quality of life at the end of life is what we're really hoping to do. If we reduce morbidity and early disability, then we have a better overall quality of life. So part of that then too is planning, right? So people will meal prep, right? Or they'll set out a specific time that they're going to meditate, or they're going to go for a run, or whatever it is. And so really helping clients with that. The other thing is, especially as we get towards the end of the semester, which is just next week, and we get to these higher level skills, we're also going to help hold people accountable. So when we're in a health coaching relationship, we can communicate with the client and say whatever needs said, right? So, okay, how is your new meditation plan going? And then if the client says, oh, I only meditated once this week, I meant to do it 4 times, or I meant to do it, whatever it was, right? Then we can say, well, let's talk about what happened. And we're just really helping them process and plan for better success the next time around. So there's actually, helping people work through and adjust to their preventative skills and hygiene. It's, I think, super rewarding because we really are helping people do things that might be the things we all know how to do, but that we can't quite get to work for us. And so when we have literally the coach, right, on the side helping and saying like, great job with this. Oh, you know what? Move your arm just a little bit, right? Or what if have you ever thought about meal planning, or whatever it is, right? We can help that client be set up for better success. So. All right, I've been lecturing instead of talking. Does anyone else have any questions that they want to ask or anything else they want to contribute to the conversation? Okay, well, that's our time then. So thank you so much for coming to my birthday party. Not really, to this conversation on my birthday. I will make this available tomorrow, and I don't need to say that because you're already listening to this if you need it. So I'm going to stop the recording